This pandemic has forced us to reckon with some uncomfortable truths, and one of them is the need for critical mental health resources. That is one of the things that is being tackled at the 53rd Eastern Region Conference for Delta Sigma Theta Sorority Incorporated. And here to talk more about this issue is Dr. Celeste Malone. Dr. Malone, I know you're going to be part of this mental health town hall, and you are just happy that there's a broader conversation about this because that is one of the key issues, isn't it, when it comes to accessing care?
Yes, we don't talk about mental health in the same way that we talk about our physical health and well-being, but our physical and mental health are so intertwined. And when I think about the situation with the pandemic, ongoing community violence, mass shootings, racial injustice, the number of stressors that we're experiencing, adults and kids, it's tapping us out. And we really do need to do something about it because it is affecting our well-being.
Why is it that people in our community have struggled with access to resources and struggled with, in some cases, even an acknowledgement that they might not be okay?
Well, mental health is seen as a taboo topic here in the United States. And then when we focus on Black communities, there's a pride in our strength and our resilience. And so to admit that there's some fault or some flaw, it's seen as something on your character. But we wouldn't stigmatize someone for having diabetes or for having a heart condition, and we shouldn't do the same for mental health. So we need to have those conversations and normalize that it's okay to seek mental health treatment the same way that we would go to a doctor for a physical.
You said something that was a little eye-opening, and we should treat our mental health like we treat our physical health. There's some things that we can do before we need that pill, before we need that face-to-face. Let's talk about that too.
Yeah, I think about self-care and making sure that we're getting adequate rest, that we're focusing on building healthy relationships within our communities and within our families, that we're really in tune to our feelings and recognizing when something feels off. Even if we can't put the label on the emotion itself, our bodies are telling us and giving us messages all the time. When we feel tense, when we're feeling upset, when we have stomach aches or headaches, that could be a sign of mental health distress, particularly anxiety.
All these things that we need to tap into, to recognize, and as a school psychologist, you have been quite busy doing that very thing. We look forward to hearing what you have to say at the town hall. Dr. Malone, thank you so much for your time.
Thank you.
And so that's just one of the things that they'll be talking about here during the 53rd Regional Conference. One of the other things we want to talk about when we come back is the economic impact of 3,000 women, plus all the resources of those women coming into Prince George's County. It's significant, and we'll talk about it with the county executive, Angela Alsobrooks, who also happens to be a Delta. And we'll be back.
Of course she is. Having very important conversations there as well as plans for action.
Yeah.
All right, Les, thank you so much. Thank Dr. Malone as well.